Hello students, good evening. Am I audible? Am I audible guys? Okay, fine. So thank you. So we are going for this second session on this NEET PG Sprint Session 2023. Okay, so we'll continue where we left. Good evening. I shared the PDF, man. I shared the PDF. Okay, excellent. We will start the session. We'll try to cover all the topics today, remaining topics. Okay, fine. Okay, we'll give it no problem. Okay, so we will give it no problem. Answer the question, guys. Okay, answer the question. Answer the question. We will start with the topic on demography, guys. We'll start with the topic on demography. True about late expanding phase of demographic cycle is. Okay. True about late expanding phase of demographic cycle. Good evening. What is the answer for this question? Yes. Okay, fine. Okay, so the demographic cycle is based on crude birth rate and crude death rate. Demographic cycle is based on crude birth rate and crude death rate, and it contains, okay, so 5 stages. The demographic cycle has 5 stages. We have 5 stages. Okay, the first stage is called as high stationary. High stationary means countries having very high birth rate and a very high death rate. This is high stationary. Okay, high stationary. Okay, fine. Next stage. Okay, next stage is early expanding. Early expanding means, okay, so second stage, the death rate begins to decline, birth rate unchanged. Early expanding. This is early expanding phase. Early expanding. The third stage, this is the answer. The question is late expanding phase. Birth rate is also lower, death rate is also lower. Okay, birth rate also started declining, then death rate also started declining. This is late expanding phase. The fourth phase is low stationary. What is low stationary means? Countries having low birth rate and death rate, guys. Okay, low birth rate and death rate. And the fifth stage is declining phase. This is the declining phase. This is the fifth one, declining phase. Birth rate is lower than that of death rate. Birth rate is lower than that of death rate. Okay. Okay, my name is Dr. Murugan. I teach community medicine. Okay, I am from Chennai, near from Chennai. Okay, fine. Yes. So this is demographic cycle. So 5 stages. Okay. So countries will have very high birth rate and death rate. Then birth rate started declining. This is early expanding phase. Birth rate is also declining. Death rate dono decline or this is late expanding phase. Then birth rate, okay, and death rate will be low. That is stationary, low stationary, and birth rate is lower than that of death rate. That is declining phase. Okay. So a country moves from these various phases is called as demographic transition. As a part of socio-economic development, country will move below. Okay, fine. So look at here. This one, India is in which phase? India is currently in late expanding phase, man. India is currently in late expanding phase. Okay, India is currently in late expanding phase. Okay, fine. Shall we go to the next question, guys? Shall we go to the next question? Yes. Fine. What is the answer for this question? A community has a total population of 10,000. Children ranging 0 to 6 years are 2,000. Literate persons. Okay, the question is they're asking to calculate effective literacy rate. What is the formula for effective literacy rate? Okay, so literate persons. Numerator is literate persons. Okay, numerator is literate persons. Denominator is we are going to include population more than 7 years. Here also more than 7 years multiplied by 100. So this is the definition we used in the census actually. So anyone less than 7 years we are not taking into consideration. 7 or more than 7 years. 7 or more than 7 years we are taking into consideration. So what is the answer here? What is the answer here? So we will get is number of people who are more than 7 is literate, means the person who can able to read and write, 4,000. And denominator is what? Okay, the only catch here is children is between 0 to 6 years is 2,000. So you have to subtract it. So you will get 100. So this is 50%, guys. So the answer is 50%. Excellent, excellent. Okay, all of you excellent. Okay, the answer is 50%. Okay, 50%. Okay, it's fine. Next terminology. Okay, whom do you call as a dependency ratio? Whom do you call as a dependence? Dependency ratio. Whom you call people as dependents? Okay, so what is the age group to call it as dependence, guys? What is the age group to call it as dependence? Age group. Come on, answer it. Dependence. Whom do you call as dependents? Less than 15 years, 65 years and above, guys. Less than 15 years and 65 years and above. They are dependents among people between 15 to 64 years. Okay, this is dependency ratio. Okay, we call it as these people as societal dependency ratio. Societal dependency ratio. Okay, so so whether they are working or not working, we call them as societal dependency ratio. Okay, age wise we are classifying. Okay, fine. So this is dependency ratio. What is child sex ratio? Sex ratio, you know. Okay, what is child sex ratio? Okay, so number of female child, values they won't ask. Number of female child 0 to 6 years by number of male child 0 to 6 years. Okay, this is sex ratio, guys. Sex ratio. Okay, child sex ratio, we keep it, this is the child sex ratio. Okay, fine. So we have seen 2 questions on this topic of demography. We have seen some demographic indicators we have seen. Demographic indicators we have seen. Okay, fine. We'll go to the next question, guys. We'll go to the next question. Answer this question. Answer this question. Approximate magnitude of completed family size is denoted by. Which one will give you approximate magnitude of completed family size? Okay, among this, which one will give you approximate magnitude of completed family size? Yes, fine. Yes. So the completed family size is given by, okay, excellent, excellent. So the completed family size is given by TFR. We call it as TFR. TFR means total fertility rate. So what does TFR indicates? TFR means, what does TFR indicates? Okay, average number of children born to a woman. Okay, average number of children born to a woman in her lifespan. So our target is TFR should be less than 2.1. This we have achieved actually. This we have achieved. So average number of children less than 2.1. This we have achieved recently. So that means 2 child norm. That means it is 2 child norm. 2 child norm. And the answer here is, that is also indicates the magnitude of the completed family size. Magnitude of completed family size is also given by this TFR. Okay, the second important indicator is what is, okay, NRR. What is NRR? Anyone, can you tell me what is NRR? Net reproductive rate means what? What is net reproductive rate? Okay, so this is a type of predicting. Your type of predicting. What you are trying to predict? Number of girl children born to a woman, okay, based on current fertility. You are trying to predict how many girl children that will be born to a woman, okay, based on current fertility and mortality. That is mortality we are taking into consideration, guys. Okay, how many girl children that will be born to a woman based on current fertility and mortality. Okay, this is what you are trying to predict. Okay, so number of girl children. What is our target? How much should be our target? NRR should be, how much should be our target? the target of NRR should be 1, guys. The target is NRR is 1. So out of 2 child, 1 child is a girl child. For that, we should have a couple protection rate of 60%. It's a common question. Okay, for that, 60% of couples should be using some form of contraception. 60% of couples should use some form of contraception. Okay, fine. This is NRR, net reproductive rate. Fine. Is this okay? The pace is fine. Are we doing well? Next. Mechanism of action of IUCD or all are. Mechanism of action of IUCD, all are. This is IUCD, intrauterine copper device. So what is the mechanism? Okay, so all are right except this one. Okay, all are right except this one, Okay, fine. Now, so IUCD, what we use in our program, the program what we use is 380A. CPR means couple protection rate. Couple protection rate means number of couples that is protected using some form of contraception. Suppose 100 couples are there. Out of them, how many percentage of them using commonly 4 important contraceptive methods we use. One is that condom, IUCD, OC pills and sterilization. So out of 100 couples, how many percentage of using any of these one methods? So which method gives maximum protection is sterilization. That to female sterilization gives maximum in couple protection rate. Fine. 380A. So what is this 380A indicates? 380 indicates surface area of copper in square millimeter on the device. Okay, surface area of copper in square millimeter on the device. This is 380A. Now, so how long you can use 380A? 380A can be used for 10 years. It can be used for 10 years. So it causes a foreign body reaction and makes uterus unfavorable for implantation. This is the mechanism of action. So what is the indication and what is the basic criteria? Okay. So the women should have no PID and minimum 1 child she should have. Okay, minimum. Okay, so ideal candidate should be minimum 1 child. Nulliparous women, you can't go with IUCD. So minimum she should have 1 child should be there. Okay, fine. So what are the absolute contraindications? So already said PID, absolute contraindication. What are the absolute contraindication? One is PID, guys. One is PID. Pelvic inflammatory disease, ectopics, previous ectopics, recently asked question, hemorrhage, guys. Okay, vaginal bleeding of unknown etiology. Vaginal bleeding. Okay, vaginal bleeding of unknown etiology. Okay, unknown etiology. Then it is an absolute contraindication. Some cancers, CA, cervix, uterus and all, some cancers. And if you are suspecting pregnancy, guys, if you are suspecting pregnancy, suspected pregnancy, these are some of the absolute contraindication. If these things are there, definitely you should not give. Now, can you tell me what is the most common side effect of this IUCD? Most common side effect. I'm just giving outline. So for crash course, it will be very useful. Okay, fine. Can you tell me what is the most common side effect? Yes, you can put it in the, yes. The most common side effect is, yes, bleeding. According to textbook of Park, bleeding. Most common reason for removal. Reason for removal is pain. Okay, so according to Park, it is bleeding, and most common reason for removal is pain, guys. So am I clear? This is demography, guys. This is demography. We have seen about IUCD. Okay, fine. Next, we'll go to the next question. All are non-contraceptive advantages of OC pills except. Okay, so we have this commonly used OC pills are Mala D and Mala N. Okay, Mala D. Perforation is not so common. Pain is the most common reason for removal. So Mala D and Mala N, composition wise both are same. Which one is free of cost? Which one is free of cost? Okay, out of this, Mala N is excellent, Mala N is free of cost, Mala D comes in social marketing scheme that you have to pay for it. You have to pay for it because if you give freely, people won't believe the effect of it. So it is Mala D comes in social marketing scheme. So scenario based question will come. So if she forget one tablet, okay, this what is the mechanism? The mechanism is it prevents ovulation. It prevents ovulation. Okay, ovulation. And the scenario based question, it should be started on 5th day of cycle. If mother is coming and if a woman is coming and she is claiming that she forgot one tablet. If she forgot one tablet, so she is supposed to take yesterday, she is coming today and she is claiming that I forgot to take one tablet yesterday. So you should tell her that take 2 tablets as soon as possible. As soon as possible. Okay, ASAP you are going to tell her. Okay, fine. Suppose another woman is coming, okay, and she is claiming that I forgot 2 tablets. So day before yesterday I am supposed to take, I forgot. Okay, yesterday I am forgot. Yesterday I also forgot. She is coming on 3rd day. So for that cycle, use other method. Use other method. Ovulation could have happened. Use other method for that cycle. For that cycle. Okay, ovulation could have happened. Okay, fine. Now, so what are the side effects that can happen? Important side effects here is MI. Okay, MI. Second is venous thrombosis can happen. Venous thrombosis. So more than 35 years, avoid it. More than 40 definitely don't give. Okay, so it can cause cholestatic jaundice. Okay, what cancer they are more prone for? They are more prone for CA cervix, and hepatic adenoma is a side effect. Hepatic adenoma. Okay, but what is the question? What is the question? Question are all are non-contraceptive advantages of OC pills. Okay, OC pills can be given for other condition, PID, benign breast disease. Okay, that is fibroadenoma, fibrocystic disease, anemia you can give. Okay, and you can also give it for ovarian cyst and ovarian cancer. Cyst and cancer. You can give it for ectopic pregnancy. So these are the other condition, non-contraceptive benefits. Apart from contraception, you can use these things. Okay, you can use this apart from contraception. Okay, fine. Yes. Hi guys. Okay, fine. Now, in the program, so we are having one more tablet. It is launched. Okay, what is Chaya? Chaya is what? Chaya is what? Chaya is, yes, it is Centroman. It is non-steroidal oral contraceptive, guys. It's a non-steroidal OC pills we are using. It composition, it contains ormeloxifene. Okay, composition, it contains ormeloxifene. Okay, this is Chaya. We have injectable. Okay, DMPA. DMPA means depot medroxyprogesterone acetate. DMPA. Okay, injectable every 3 months once you can give, and it comes under the program under the name of Antara. Okay, it comes under the name of Antara. Okay, fine. Under the name of Antara. Okay, fine. Are you able to follow this? Yes. Okay, fine. Yes. Okay, fine. So able to follow? Able to follow this? Some lag is there, huh? Fine. Fine. We'll go to the next question, guys. We'll go to the next question. Okay. Answer this. Use soup and Lance method is used for. Use soup and Lance method. Use soup and Lance method it is used for. Okay. Use soup and Lance method. Okay. Fine. What is it used for? Use soup and Lance method it is used for. Yes. So this we are talking about emergency contraception. Okay. Emergency contraception with OC pills. Okay. Fine. Emergency contraception with OC pills. This is one method. What is the second method you can give is that emergency contraception with IUCDs you can give. Okay, this you have to give OC pills you have to give within 72 hours. Okay, we can give within 72 hours you can give. And IUCDs you can give for 5 days. 5 days you can give IUCD. These are two methods. Third you can give third one you can give, okay, OC pills with high estrogen dose. High estrogen dose. Okay, this also you can give within 72 hours. This also you can give within 72 hours. Okay, fourth one what you can do is that you can give EC pill. Okay, it comes in the program, that is levonorgestrel pill. Okay, levonorgestrel pill. This pill also you can give for 72 hours. 0.75 milligram. You have to give 2 tablets, guys. 2 tablets. This also you can give within 72 hours. This also you can give within 72 hours. The next one, fifth method is you can give mifepristone. Okay, you can give mifepristone. Okay, this you can give within 72 hours. So you can use these 5 methods, guys. You can use these 5 methods, okay, as emergency contraception. So among this, OC pills with that method is called as use soup and Lance method. Use soup and Lance method. Okay, fine. Okay, this is the EC pill. It's available in the program. It's available. EC pill is available in the program, guys. Okay, fine. We'll go to the next question. They can use this. Okay, they can use this emergency contraception. Rape victim, they can use this emergency contraception. They can use. Okay, based on the acceptance, you can give the victim. You can give EC pill. Okay, fine. Yes. So what is this? So we are going to evaluate the contraceptive methods. Okay, so what does Pearl Index does? Pearl Index calculates contraceptive failure rate. It calculates contraceptive failure rate. Okay, calculate contraceptive failure rate. So what is the formula? Number of accidental pregnancies. What is the answer here? Yes, you are doing well. Number of accidental pregnancies by total months of exposure multiplied by 1200. This is the formula, guys. Okay, number of accidental pregnancies by total months of exposure, okay, multiplied by 1200. Okay, so you have to remember the formula. It has been asked, okay, in the NEET exam. This question been asked multiple times, so you should be able to answer this. So what is the numerator? What comes numerator? Numerator is 5. How many pregnancy? 5. What is the denominator here? What is the denominator here? What is the denominator? So the denominator is, okay, so or 20 months. But 20 months is for one woman. Okay. So how many women we followed? We followed what? Is 100 women we followed. So you have to multiply it with 100. Okay. So this gives 6,000 by 2,000. So answer is 3. Yes, it comes 1200. 1200. 12 months into 100. Remember, it is 12 months into 100. Okay, so you calculate in 100 women years we give. Okay, Pearl index we give in 3 per 100 women years. So 100 women years, each year 12 months are there. That is why the multiplication factor is 1200. 1200. Each woman 100. Each woman 12 months, 100 women years means, so 100 multiplied by 12. Fine. Okay, is it fine? Shall we go to the next topic? Demography is over. Please answer it. We can go into biostatistics. Fine. Now we go into biostatistics. Okay. So for NEET exam is concerned, for the past 2 years we are not having biostatistics question. Let us assume that they will ask question. For previously they used to have 3-4 questions. For the past 2 years probably one or no question. Last exam there was no question. Let us assume we will have more question. Okay, fine. First is data. The question answer here is, okay, what you are saying is right. This is ordinal. This we have data. Any information I am collecting from you is data. So we have 2 types of data is there, quantitative and qualitative. Quantitative means measurable. Anything that is measurable, height, weight and all measurable, guys. So that comes quantitative, anything that is measurable. Qualitative means it is not measurable, it is only countable. Okay, not measurable, only countable. Okay, fine. So how many males are there, how many females are there? Okay, sex and religion are qualitative, and quantitative means it is measurable. Okay, height, weight, BMI, blood pressure, all that is okay, fine. So qualitative, we have further subtypes. We have one is nominal. Nominal means only 2 categories. Okay, only 2 categories. 2. Okay, I am asking you the question. Okay, for that question only 2 categories are there, means it is nominal. For example, sex. Okay, male and female. Okay, leave transgender. Okay, male and female. Present or absent. Sleeping or not sleeping, alive or dead, yes or no. These are nominal categories. Okay, so only 2 categorization is possible, nominal. Second is ordinal. What is ordinal? Ordinal means more than 2 categories. Okay, with a meaningful order is there. Okay, meaningful order, more than 2 categories, there is a meaningful order is there. Okay, so I'm asking you a question. How is the fever? Fever may be mild, moderate and severe. So mild, moderate and severe. Mild, moderate and severe. More than 2 categories are there, and there is a meaningful order is there. Mild is less than that of moderate, moderate is less than that of severe. Okay, fine. The question what they asked here, the question they asked here is about severe. Severe means, okay, fine, it is ordinal data. Okay, hello. Okay, so this is ordinal data. Okay, ordinal data, mild, moderate and severe. Able to follow this? This is ordinal data. Okay, one more question I will ask, recently asked in AIMS exam. Okay, Glasgow Coma Scale. It's what type of data? Glasgow Coma Scale is an example for what type of data? Glasgow Coma Scale. Yes. Glasgow Coma Scale is an example for, that is also ordinal data. So eye movement will be there. Okay. Motor response. Okay. So 3 parameters you are going to check, and there is a scoring pattern will be there. That is also an ordinal data. Next question. Type 1 error is said to have occurred if. Type 1 error. Okay, so type 1 error is said to have occurred if. Okay, what is this? Okay, fine. First, let us see certain points. First is, what is null hypothesis? Okay, what is null hypothesis? Suppose I have two drugs available. I want to check whether one drug is better than the other drug. Okay, so I can do some test of significance. So where will you use this null hypothesis? We will use during test of significance. Okay, test of significance. Okay, we'll use this null hypothesis. So what is this null hypothesis means? Suppose I have two drugs. I want to prove one drug is better than the other drug. So I can use this null hypothesis. What is null hypothesis? It's an assumption. Assume both groups are same. Assume. Okay. You are going to assume both groups are same. And you have to either accept it or reject it. So you are going to assume it. Both groups are same. So for one group you are going to give drug A. For other group you are going to give drug B. Then after that you do some statistical test. You will get p values. Okay. If the p value is significant means, okay, you are going to reject null hypothesis. If p value is not significant means you are going to accept null hypothesis. I am repeating again. So for test of significance I have two groups. So I want to check whether one drug is better than the other drug. So I can do the test of significance. My first assumption will be assume null hypothesis. That means I am making an assumption that both the groups are same. After that, okay, I am going to do some statistical test. So I will get p value. If p value is significant, I am going to reject null hypothesis. Reject null hypothesis. Okay, if p value is not significant, I am going to accept null hypothesis. That means not significant means actually both the groups are same. P value is significant means, okay, one group is better than the other group. Okay, fine. Now what is type 1 error? In this context, what is type 1 error? Type 1 error is alpha error. It is also false positives. FP means false positives, alpha error. What is type 1 error? Rejecting null hypothesis. Okay, rejecting null hypothesis when it is true. Able to follow this? Okay, type 1 error means rejecting null hypothesis is true. That means both the groups are same. You are falsely concluding that one group is better than the other group. This is type 1 error. Reject null hypothesis true means both the drugs are same, but you are falsely concluding one drug is better than the other drug. Okay, fine. The second one is type 2 error. Type 2 error. This is beta error. Okay, this is false negatives. Okay, false negatives. What does it mean? Accepting null hypothesis. Okay, when it is false. Okay, accepting null hypothesis when it is false. What do you mean by that? Accept null hypothesis is false. What that means that both the drugs are not same, but you are concluding both the drugs are same. Null hypothesis when it is false means both the drugs are not same, that you are concluding both the drugs are same. Okay, now answer this question. Okay, so type 1 error is what? Okay, answer the question. Type 1 error is said to have occurred. Yes, null hypothesis is true. Okay, but rejected. This is what we have. So null hypothesis is true but rejected. This is type 1 error, guys. This is type 1 error. Fine. Are you able to follow this? It's an important concept. Are you able to follow? Please answer. Null hypothesis true means both the drugs are same. Okay, I am doing a research. Null hypothesis true means both the drugs are same, but I am concluding one drug is better than the other drug. So that is type 1 error. False positive. That means both the drugs are same, but I am concluding that one drug is better than the other drug. That is type 1 error. What is type 2 error? Type 2 error means both the drugs are not same. One drug is better than the other drug, but I am falsely concluding that both the drugs are same. This is type 2 error. Don't worry, you remember one. You remember one type 1 error, you remember the exact opposite is type 2 error, type 2 error. Type 1 you remember exact opposite is type 2. Okay, fine. Next question. P value is significant when it is less than. When the p value will be significant, I said if you do any statistical test, you will get p value. 2 points we should know. So this was a NEET question. Okay, so when it is significant, when it is less than 0.05. What is p value? P value is probability of type 1 error, guys. Okay, p value is probability of type 1 error. What is the chance of type 1 error? Okay, so what is the chance of type 1 error? Usually we will keep it as 5%. The type 1 error maximum how much we will allow is 5%. Usually we will keep it as 5%. This is type 1 error. So 5% corresponds to probability 0.05. Okay, 5% of type 1 error. Probability ranges from 0 to 1. Probability usually ranges from 0 to 1. So 5% of type 1 error corresponds to 0.05. Okay, 5% corresponds to 0.05. Okay, this is p value, guys. P value when you call it as significant. Next. Answer this question, guys. Answer this question. Which of the following is used to compare to independent means when data is normally distributed? Okay, fine. Any question, if it is asked like this, okay, first you have to see certain things. First, let us, p value means probability of type 1 error. Okay, p value is type 1 error, what we said, false positive. What is the chance of false positives? The chance of false positive, we keep it as 5%. That 5% corresponds to probability value. Probability ranges from 0 to 1. Probability ranges from 0 to 1. So the 5% corresponds to 0.05. 5% is 0.05. Now, when we having data, look here, whenever this question being asked, it may be a quantitative data. Simple questions only they will ask in the exam. So for a NEET exam, so mostly what they will ask is parametric test. Okay, so mostly they will ask is parametric test. Okay, so what you have to see that whether the data is quantitative and qualitative. Okay, then how many groups are there? How many groups are there? If 2 groups are there, then it is unpaired t-test. Okay, it is unpaired t-test. If 2 groups are there means unpaired t-test. Only one group. For example, what we said is, so there is a group of people are there, hypertensives. Hypertension is a quantitative data. So I want to compare, I have 2 drugs available. So I divided the hypertensive people into 2 groups. For one group I am going to give drug A, for other group I am going to give drug B. After some time I am going to compare their blood pressure. So blood pressure is a measurable data. How many groups are there? 2 groups are there. Then I should go for unpaired t-test or student t-test. Both are same. Okay, both are same. Okay, 2 groups means we can go with this. Only one group is there. Let us assume we have only one group is available. So hypertension, suppose 50 hypertensives are there. So today I am checking their blood pressure. I am giving a drug. After 1 month I am rechecking their blood pressure. So only one group, before the drug, after the drug. Okay, then it becomes paired t-test. Then it becomes paired t-test. Okay, only one group, before the drug, after the drug, then it becomes paired t-test. Okay, fine. More than 2 groups are there, then we can go for ANOVA. Okay, we can go for ANOVA. In NEET exam, usually they will ask this. Okay, usually they will ask this concept, they will ask NEET exam. Usually they will ask unpaired t-test and paired t-test. Okay, fine. Now what you do is that now read the question and answer it. Read the question and answer. Sorry. The question they have given, the clue here is means. Means it is quantitative data. Means it is quantitative data. Means quantitative, measurable data. How many groups are there? 2 groups. Now tell me what is the answer. Fine. So the answer here is student t-test, guys. Student t-test. Okay, fine. Fine. One more we have concept for qualitative data. Qualitative data. If qualitative data, 2 groups question they will ask. Usually what they will ask is chi-square test. We'll stick on to very simple, okay, things. Okay, INA exam means it will be complicated. Okay, we'll stick to this. Okay, so qualitative, 2 groups, chi-square test. Okay, 2 groups. How will you know that it's a qualitative data? Qualitative data, the question somewhere they may mention percentage or proportion. Both are same only. The question may say, okay, so percentage, okay, or proportion. Proportion they will say, percentage or proportion. If it is said means it is qualitative data. Usually these are the 3 commonly asked question. Okay, fine. Student t-test and PART test and chi-square test. What you are supposed to see is that what type of data. First point, how many groups are there? Then it is easily answerable. Okay, fine. In chi-square test, you will find in undergraduate time, probably they would have taught you how to calculate degree of freedom. So the degree of freedom is column minus 1 multiplied by row minus 1. Row minus 1. Z-test is more of a parametric test. Dr. Rahul, Z-test is more of parametric test. Okay, mostly that is also qualitative data, but mostly we use chi-square test. Z-test also we can use, but mostly the question is mostly with chi-square test. Fine. Next, we'll go to the next question. Last time also we had a question. Normal distribution curve depends on. Yes, normal distribution curve depends on mean and what is the answer? It depends on mean and standard deviation. Mean and standard deviation. Okay, fine. Okay, this is a normal distribution curve. Let us assume it's like this. Okay, fine. So first here, what are the properties of the normal distribution curve? Okay, fine. Important points around we will see. It's a bell-shaped bilateral symmetrical curve. Okay, that is fine. So for this curve, mean, median and mode all should be same. Mean, median, mode all should be same. Second, area is equal to what? Maximum area for this curve should be 1. Next. Now the key point here is mean plus or minus 1 standard deviation corresponds to 68% of the area. Mean plus or minus 1 standard deviation. Mean plus or minus 2 standard deviation is 95% of the area. Mean plus or minus 3 standard deviation is 99% of area. So 1 standard deviation is 68, 2 means 95, 3 means 99. So what does it mean? What does they imply? Okay, fine. So look here. Let us take a study. In a study, mean is 160 centimeters. Standard deviation is 5 centimeters. So what do you mean by that term? Okay, fine. So let us calculate from this. So how much is the mean? Plus or minus 1 standard deviation. That is 160 plus or minus 5. That is 155 to 165. So in a class, I am calculating mean and standard deviation. So from them, I calculated mean. Okay, height I have taken. Okay, suppose in a UG batch, class is there, 150 students are there. So among them, I calculated the mean and standard deviation. Mean plus or minus one standard deviation, that is confidence interval. So it comes as 155 to 165. What does it mean? That means 68% of people in this class will range from 155 to 165 centimeters. That is the interpretation. 68% of people in the class will have a height between 155 to 165 centimeter. Next, mean plus or minus 2 standard deviation, that is 150 to 170. How many percentage will fall between this? How many percentage? Yes, in this gap 95% will fall between this. 95% will fall between this. Third, mean plus or minus 3 standard deviation, that is 145 to 175. In this range 99% will fall between this. 99%. Okay, fine. Able to follow this? Okay. Shall I continue? Shall I continue? Yes. Okay. We'll see some graphs, guys. We'll see some graphs. Okay, we'll see some graphs. Okay, fine. Okay, fine. We'll see some graphs, guys. We'll see some graphs. What is this graph? What is this graph? Sometimes they ask, okay. Okay, so what is this skewness? You want skewness. Okay, skewness means when the data is not normally distributed. Okay, sometimes data will be like this. Skewness means, okay, so sometimes data will be like this. Okay, data will be like this. Okay, so this is the tail. So tail, we have tail means this side, right side. To your right side, tail is there. So to your right side, that means this is right skewed or positively skewed. You can call positively skewed. Okay, so if it is on the right side, it is right skewed or positively skewed. Okay, fine. So sometimes the data may be looking like this. The data may be looking like this. Okay, so this side means it is negatively skewed or left skewed. It is based on the tail. If they are asking picture means you can say left or negatively skewed. Okay, fine. Is it clear? Is it fine? Everybody okay? Okay, right skewed or positively skewed. Here it is left skewed or negatively skewed. Negatively skewed. Okay, fine. Next, we'll go to this left graph. We will see what is this graph. What is this graph? What is this graph? This graph is simple bar chart. Okay, simple bar chart. Okay, simple bar chart. Okay, so whatever your character of interest, you take it in the x-axis. Character of interest, you take it in the x-axis. Okay, fine. And there will be space will be there between the bars. Space between the bars. Okay, fine. Space between the bars. Okay, this is simple bar chart. Simple bar chart. Fine. What is the GPAT Nipper batches? Okay, somebody is doing something. Okay, fine. What is this next graph? Next graph. What is this next graph? The next graph is, this is multiple bar chart. Okay, multiple bar chart. multiple bar chart. Okay, what is this multiple bar chart? Multiple bar chart. Okay, so multiple bar chart. What is this multiple bar chart? So this multiple bar chart, two parameters you are comparing side by side. Two variables are comparing side by side. Okay, side by side. You are comparing two variables side by side. You are comparing. Okay, so blood groups between male and female. Okay, side by side you are comparing. This is multiple bar chart. Multiple bar chart. Okay, fine. Side by side comparison. This is also what data? This is also for qualitative data. Okay, fine. What about this graph? This was asked in NEET exam few years back. What is this graph? This we call it as component bar chart. Component bar chart. What is this component bar chart? Component bar chart is, yes, this is component bar chart. Two variables are compared within the bar. Two variables within the bar. Within the bar we are comparing two variables. Okay, so within the bar itself, how many males were there, how many females were there. Okay, whatever character of our interest we have taken. This is component bar chart. Component bar chart. Next, what is this graph? Yes, this is excellent. This is pie chart. This is pie chart. Okay, this is pie chart. This is also for qualitative data. Qualitative data, it comes in percentage. It comes in percentage. So 100%. This entire circle corresponds to 100%. This is pie chart. Qualitative data. Pie chart. Qualitative. What is this graph? This graph is called as histogram. Histogram. Okay, this is histogram. This is for quantitative data. Quantitative. This is for quantitative data. And look here, cholesterol. We are taking into cholesterol here. And there is no space between the bars. So what is not there? No space between bars. Okay, there is no space between the bars. This is histogram. Histogram. Okay, no space between the bars. Okay, fine. What is this graph? Next graph. What is this graph? So here time is there. If time is there, what is this graph? Okay, time. If time is there, then it is called as line diagram. This statement was asked 2 years back. What is the use of line diagram? This line diagram will show you, so it shows the trend. Okay, how many number of patients. Okay, this line diagram will tell you trend of the disease. Trend of the disease over a period of time. What is the trend of COVID cases? Okay, what is the trend of COVID cases? Trend of the disease over a period of time. This is line diagram. Line diagram. Okay, fine. Next. Next is what is scatter diagram. This is the last graph. Scatter diagram. What is scatter diagram? Scatter diagram. Okay, fine. It is plotted between. Suppose I want to find out what is the relationship between age and body weight. Okay, what is the relationship between age and body weight? Okay, age and body weight. So as the age increases, what is going to happen? The body weight also increases. Okay, this is scatter diagram, guys. This is scatter diagram. So what is the use of this scatter diagram? Scatter diagram will tell you relationship between two variables. Okay, scatter diagram will give you relationship between two variables. That is scatter diagram. Okay, fine. So am I clear? So we have seen some this is positive correlation, you can say in terms of correlation. Okay, age and body weight is positively correlated. Okay, if one increase one variable, the other variable increases, means it is positively correlated. Okay, fine. So is it fine? Shall we go to the next areas, guys? Able to follow? Please put it in the chat box. Okay, able to follow? Fine. Now next we will go into maternal and child health topic. We will see maternal and child health topic. We'll take class till around 10 to 10:15. We will have class. Okay, fine. Yes. So as compared to cow's milk, breast milk contains more of what? Okay, so if you take cow's milk, okay, it is rich in protein, energy, fat, calcium. All are more in cow's milk. What about breast milk? Okay, so more amount of rich in lactose. It is rich in iron with high bioavailability. More amount of vitamin A, C, D and all. So vitamins also more, and it will have these immunoglobulins will be there. Okay, so anti-infective factors. Okay, so anti-infective factors. The lactose will be there. That is essential for growing brain of the baby. And it is rich in essential fatty acids. That is linolenic acid. Those things are more in breast milk when compared to cow's milk. Linolenic acid. Okay, now I think 2 years back or somewhere 1 year back, we had a question. So when compared to breast milk, how much time more protein is there? So breast milk contains protein, okay, 1.1 gram per 100 ml. Okay, cows is having 3.3 grams per 100 ml. Okay, so there is 3 times more is there. Okay, so this was asked, I think a few years back, 3 times. Okay, cow's milk contains 3 times more protein when compared to breast milk. 3 times more protein. Now answer the question, guys. Now answer the question. What is the answer here? As compared to cow's milk, breast milk contains more of lactose. Okay, the lactose is for growing brain of the baby. It is very important. Lactose. Okay, fine. Next. So regarding antenatal care, what is the minimum number of antenatal visits should be there? Minimum visits. Okay, minimum number of visits. Okay, we recommend 4 visits. Okay, 4. Okay, WHO recommends 8 visits. Okay, we recommend 4 visits. WHO recommends 8 visits. And how much extra calories should be there during pregnancy? So extra calorie pregnancy should be plus 350 calories. Okay, plus 350 calories. Lactating mother, first 6 months. Okay, first 6 months lactation. Okay, lactating mothers, you should have plus 600 calories. Second 6 months plus 520 calories. Okay, fine. 600 plus 520 calories. Okay, these are extra calories that is required. Recently, I think we had a question. WHO recommends how many visits? They recommend 8 visits. So we are having 4 minimum. These are minimum. Okay, fine. Next. All are included in Gangaru mother care except. Yes. Gangaru mother care, all are included except. Gangaru mother care is basically for improving the survival of these low birth weight babies. Okay, low birth weight babies to improve the survival. So if it is having what is this low birth weight babies means? Less than 2.5 kg, less than 2.5 kg. Okay, so skin to skin contact should be there, that is right. Next, exclusive breastfeeding should be there. If you do both these things, automatically weight gain will be there. Okay, if there is a weight gain, early discharge from hospital, you can do it. Okay, fourth component is they require support in the community. Support in the community by health workers. Okay, community by health workers. Health workers will go, okay, and they will provide support in the community. This is Gangaru mother care. So the baby will be put on the mother's chest. Even dresses are available. Okay, they will put on mother's chest. Dresses are available. So they can what they can do is that, so this actually will improve the chance of survival rather than putting the baby in NICU. Okay, NICU is a high risk environment, guys. Okay, fine. There is no free nutritional supplement. Okay, fine. Next. Answer this question, guys. Before going into this, we will see some other points. For growth monitoring, okay, what are the indicators we do? Okay, growth monitoring, what are the indicators we have? One is that weight for age we can use. Okay, second is weight for height. Okay, this we call it as wasting, weight for height. Third is height for age. This we call it as stunting. Okay, out of this, can you tell me which one indicates acute malnutrition, which one indicates chronic malnutrition? Weight for age, weight for height, and height for age. So out of this, yes, answer it. The first two, yes, these two indicates acute malnutrition. Okay, acute malnutrition. Height for age, stunting, that indicates chronic malnutrition. Chronic malnutrition. Weight for age indicates weight for age, weight for height. Okay, acute malnutrition. Height for age, chronic malnutrition. Now, when will the birth weight will be doubled? Usually, birth weight doubles by 5 months, triples by 1 year, quadruples by 2 years. Okay, and when will the height will be doubled? Height of the baby. When will the height of the baby will be doubled? Height. Okay, height doubles in. Height will double in 4 years. Okay, birth height is 50 centimeter to reach 100 centimeter. It takes 4 years, guys. 4 years. Not 6. Okay, months you are saying. Okay, not 2 years. It is height doubles at 4 years. No. Which are the following indicators used for growth monitoring at Anganwadi Center? Anganwadi Center is the place where we monitor the growth. So Anganwadi Center, we use WHO growth charts. Okay, and it is based on weight for age. Okay, it is based on weight for age. And we have this, what is the weighing scale we use? We have weighing scale called as Salter's weighing scale. Okay, we have scale is Salter's weighing scale. Okay, we have weighing scale, Salter's weighing scales. We have Salter's weighing scale. Okay, so look here, it will be like this. The growth chart will be like this. Age you will take in the x-axis. Okay, weight you will take it in the y-axis. Now this will be the median. From median to -2 standard deviation. Okay, from that -3 standard deviation. Median -2 standard deviation, -3 standard deviation from median, negative side. If the weight ranges between these two, this is normal. Between -2 to -3 standard deviation means, okay, mild to moderate undernutrition. Okay, mild to moderate undernutrition. Okay, so less than 3 standard deviation means it is severe undernutrition. Less than 3 standard deviation means it is severe undernutrition. So we have this color coding will be there. So normal means I think it will be green color. Mild to moderate is yellow color. The baby monthly, they will check the weight of the baby monthly. Severe undernutrition is red color, guys. Red color. Severe undernutrition is red color. Okay, fine. So am I clear? So this is the growth chart we have. This is the growth chart. So monthly we will plot and we will check the whether the direction is increasing or decreasing or it's stagnant. Okay, so we will monthly they will put a dot and they will check whether it's increasing or not. If anything is there, then they will refer the case at the Anganwadi level. Okay, fine. Now, what is the criteria for SAM child? Severe acute malnutrition. Okay, severe acute malnutrition. What is the criteria for SAM child? What is the criteria? Okay, fine. Weight for height we are going to include. So here weight for height. Weight for height less than, okay, 3 standard deviation. Okay, fine. Second, we have mid-arm circumference. Okay, you should mid-arm circumference 1 to 5 years we will take it, and it is less than 11.5 centimeter. Mid-arm circumference. Third, okay, third mid-arm circumference 11.5 centimeter, and third point is that so presence of nutritional edema or wasting is there. Nutritional edema, it may be a Kawashiorkor or marasmus, okay, wasting, okay, or wasting, okay, wasting is there, then it is severe acute malnutrition. Where will you refer the case? You can refer this case to NRC, that is Nutritional Rehabilitation Centers. Okay, so you have to refer this case to Nutritional Rehabilitation Centers. Okay, fine. This is severe acute malnutrition. Severe acute malnutrition. Fine. Able to follow this? Fine. Okay, we'll go to the next question, guys. Okay, current mortality, just namesake I have given. Okay, fine. So we are not going there. We are not going into it. Now, so we will see MMR. MMR, what are the points we should know? MMR, okay, multiplication factor is usually 1 lakh. Okay, only indicator we multiply it with 1 lakh is MMR. All other indicators we multiply it with 1000. Okay, fine. What is the most common cause of MMR? The most common cause is PPH. Postpartum hemorrhage, guys. Postpartum hemorrhage, MMR. Okay, fine. Next. Next is, what about perinatal mortality rate? What is perinatal period? So we will see the timeline we will see. Okay, so period of viability in India, starts with birth. Sorry, period of viability is 28 weeks. So our definition is 28 weeks. 28 weeks to birth. Birth to 28 days. 28 days to 1 year. This is the time period. So in this, if any deaths are happening here, this we call it as stillbirths. Okay, if any deaths are happening here, that crosses viability and before birth. So this is stillbirth. Less than 28 weeks, it's abortion. Okay, fine. Now, 0 to 28 days, if any deaths are happening, this is neonatal deaths. Okay, it is neonatal deaths. Okay, fine. 29 days to 1 year, we call it as post-neonatal. Okay, post-neonatal. 0 to 1 year, this whole period is infant, that is neonatal and post-neonatal, that is infant deaths. Okay, fine. So you are going to divide here 0 to 28 days, you are going to divide 0 to 7 days. 0 to 7 days. If any deaths are happening here, this we call it as early neonatal deaths. Early neonatal deaths. This we call it as late neonatal deaths. Late neonatal deaths. Okay, this we call it as late neonatal deaths. Infant mortality 0 to 1 year. Okay, late neonatal deaths. Now the question is, what is perinatal period? Perinatal period includes both stillbirths and early neonatal deaths. Perinatal. Perinatal includes both stillbirths as well as early neonatal period. Perinatal period. Okay, fine. Now, so what is perinatal period? What are the points we should know? Perinatal period, okay, is considered as a perinatal mortality rate. Perinatal mortality rate is considered as an indicator for what? Yes, it is considered as an indicator for pregnancy wastage. Okay, pregnancy wastage. Perinatal mortality rate is considered as an indicator for pregnancy wastage. Infant mortality rate, okay, is considered as an indicator for, okay, for under 5 we will write. Okay, under 5 first we will write. Under 5 mortality rate, social development and well-being. Under 5 is considered as an indicator for social development and well-being. Okay, infant mortality rate 0 to 1 year. Okay, 0 to 1 year, it is considered as an indicator for health status. Follow, guys. It's stuck, huh? Am I audible now? Okay, fine. Now, what is the most common cause of infant mortality, under 5 mortality, and neonatal mortality? What is the most common cause? Infant, okay, infant, neonatal, and under 5. Okay, so for this, it is low birth weight or prematurity, guys. It is low birth weight or prematurity. Low birth weight or prematurity. Okay, fine. That is the most common cause. Fine. Okay. We'll go to this question. Not pneumonia. Not pneumonia. It's low birth weight or prematurity. Okay, fine. So ICDS include all except. Okay, so ICDS, all are part of ICDS. Which one is not part of the ICDS? Yes, it is family planning. It is family planning. Family planning. So ICDS, Integrated Child Development Services, who are all the beneficiaries? The beneficiaries are between 0 to 6 years children. Okay, fine. Okay, pregnant and lactating mothers. Okay, the beneficiaries are pregnant and lactating mothers. Okay, women in reproductive age group between 15 to 44 years, and adolescent girls, guys. Okay, 11 to 18 years girls. Okay, 11 to 18 years girls. These are the beneficiaries. The main activity where this ICDS work is called as Anganwadi. Okay, Anganwadi. Anganwadi will be there for every 400 to 800 population. Whether it is a rural area or urban area, it is available at 400 to 800 population. It will be there. Anganwadi. Okay. 11 to 18 years girls. 11 to 18 years girls. Now, what are the things that will happen? Immunization will happen in Anganwadi. Okay. So, immunization usually will happen in Anganwadi. Health education they will provide, and supplementary nutrition they will provide. Okay, so what is supplementary nutrition? What is supplementary nutrition? So they will be providing children every day 6 months to 6 years children. 6 months to 6 years children, they will be providing 500 calories of food daily and 12 to 15 grams of protein. Okay, 500 calories and 12 to 15 grams of protein they will be providing. Okay, this is between children between 6 months to 6 years. The child is malnourished. If the child is malnourished, they will be providing malnourished. Okay, so mild to moderate undernutrition is there. 800 calories and 20 to 25 grams of protein. What you are saying, that is for Neelam, that is related with midday meals, not here. This is ICDS. Usually they will provide food in either packed food they will give, for children and all they will cook and they will give. Okay, or for pregnant women and all they will be providing powder will be there. So you have to put it in the boiling water and you have to take it. So pregnant and lactating mothers, for pregnant and lactating mothers, you have to provide 600 calories and 20 to 25 grams. Here it is 18 to 20 grams of protein. 18 to 20 grams of protein. So am I clear? This is for ICDS. This is supplementary nutrition. How many days? This has to be given 300 days in a year. Okay, 300 days in a year. Okay, 300 days in a year we will give. Okay, fine. As part of National Nutrition Mission, we have this Poshan Abhiyan is there. Okay, fine. Now, so we want another one. What you are discussing is midday meals. For midday meals, okay, midday meals in schools they have to provide 250 days in a year. 250 days in a year. So every day the children they should be provided. Energy should be they should fulfill 1/3 of energy and half of protein requirement. Okay, protein requirement half, energy 1/3 and half of protein requirement they should be providing. Okay, fine. So am I clear? So this is about the topic on this what is this, maternal and child health. Okay, fine. Shall we continue to the next one? Yes. Okay. Okay, we will go to the occupational health, guys. We'll go to the occupational health. Okay, occupational health. Safety officer have to be appointed in factories where number of workers is more. So this we have a Factories Act is there. This is Factories Act. It's a small topic. Regularly you get questions. Factories Act 1948. This act recommends there should be 500 cubic feet space should be there for worker. 500 cubic feet space should be there per worker. There should be one safety officer for every 1,000 workers. Okay, 1,000 workers. Okay, fine. That is the answer. And there should be one welfare officer. There should be one welfare officer for every 500 workers. We'll stick on to what is there in park. So there should be one canteen should be there for every 250 workers, and one creche. Creche means child playing area. 30 mothers are there. So this is where they can bring the child and the child can play. Okay, this is the recommendations. Okay, less than what age is banned? Less than 14 years is banned. Okay, less than 14 years are banned from working. Okay, so people between 15 to 18 years, they can work between 6 a.m. to 7 p.m. So that means they should work in during daytime only, and they have to be certified by the doctors. Government doctor has to certify these people have achieved the age. Okay, fine. So next question, What is the maximum working hours? Maximum working hours. Maximum working hours is 48 hours per week. Okay, 48 hours per week. Okay, one day should be holiday. Every day we should have 8 hours of working days. Okay, fine. So including overtime, I think 1 or 2 years back it was a NEET question. With overtime means 60 hours per week. Okay, 60 hours per week, including overtime. So including overtime, it is 60 hours per week. Okay, so am I clear? So these are the points. This was probably the recent question in this topic. This was the recent question what we have, overtime. Next, we'll go to the next question. We'll go to the next question. The employee diagnosed with TB gets extended sickness benefit for how long? This is associated with ESI. Okay, ESI scheme. This is also 1948 came into force. It is a form of social security to the workers. Social security to the workers. So ESI, there are some benefits are there if the worker contributed, and the employer also have to contribute. Okay, so worker has to contribute some amount, employer has to contribute. Okay, so if they are contributing, what are the benefits they will get first? Okay, so for the worker, if you take, these are the benefits for the workers. So first is medical benefit for them, also for the family members, also medical benefit. Second is if they are sick, so they can take sickness benefit. They can take sickness benefit for 70% of wages for 2 years. 70% of wages for 91 days. PG overtime definitely is there. Okay, fine. So you will not come under this. So sickness benefit is 70% of wages for 91 days. The question is related with extended sickness benefit. We have certain conditions are there. Extended sickness benefit. This is 80% of wages for 2 years, guys. Okay, 80% of wages for 2 years. 2 years. Okay, fine. So we have TB is there, we have MI is there, we have stroke is there. Okay, so they have a list of some 34 conditions are there. If any of these conditions, if you are having, okay, this much amount of extended sickness benefit they can get for 2 years, 80% of wages. Next is they can get enhanced sickness benefit. Enhanced. Just go with the name actually. Enhanced sickness benefit. So how much they will get? So enhanced sickness benefit for vasectomy. The person is undergoing vasectomy, 7 days. The person is undergoing tubectomy. Okay, 14 days they can get with 100% of wages. Okay, 100% of wages. Okay, fine. Okay, the person is undergoing vasectomy. Okay, she can take 7 days leave, or they can get operated in ESI hospital. Okay, for that wages will be given. ESI will pay for them. Okay, fine. Next is what is next? We have maternity benefit. Okay, we have maternity benefit. So what comes in maternity benefit? In maternity benefit, we have. So what comes in maternity benefit is, suppose a woman undergoing delivery. For delivery, okay, so we give it for 26 weeks, guys. Okay, for delivery we give it for 26 weeks, 100% of wages. Okay, 100% of wages. If abortion happens, 6 more weeks they give, but delivery they give 26 weeks, 100% of wages according to Maternity Benefit Act. So they also provide funeral benefit is there. Okay, they provide some 15,000 rupees. Temporary disablement benefit is there. Somebody died means they will provide dependence benefit is there. These are the benefits for the employees, that is workers. These are the benefit for employees. So dependence benefit is there. Funeral benefit you take. Okay, funeral benefit, if somebody died, so they will pay around 15,000 rupees. Okay, they will pay 15,000 rupees. Okay, this is funeral benefit, guys. Okay, fine. So these are the benefits. Okay, as somebody said that. So employer has to contribute, employee also has to contribute. Okay, so employer, worker, owner has to contribute 3.25 percentage. Okay, worker has to contribute 0.75 percentage. So they will collect this money monthly. So for that, some benefits are there is for employers as well as employees. So these are the benefits we have seen. Employees. Okay, fine. We'll go to the next question. All of the following statements about silicosis is true except. Yes. So this question is related with pneumoconiosis. So what is this answer? Yes. This is pleural plaques. But this is pleural plaques. All the following statements, silicosis are true except this is pleural plaques. So silicosis, okay, is the most common pneumoconiosis. Most common pneumoconiosis. Dependence benefit means if somebody died during the working age, if somebody died means, okay, for their family members some amount of benefit will be given. That we call it as dependent benefits. Okay, so most common pneumoconiosis, okay, most common pneumoconiosis, okay, is silicosis. So it happens because of inhalation of free silica. Okay, this happens due to inhalation of free silica or silica dioxide. Okay, so usually mines, coal gold mines. Okay, so KGF, this is where they first discovered it. So which part of the lungs will be affected means they will be affecting more of apical lobes will be affected. Guys. More of these upper lobes will be affected, and they are prone for what? TB. This is also true. They are prone for TB. Okay, and X-ray will show snowstorm appearance. Okay, X-ray will show snowstorm appearance. Okay, X-ray will show snowstorm appearance, guys. X-ray will show snowstorm appearance. So these are the points regarding silicosis. Okay, what about asbestosis? Okay, so this asbestosis, okay, affects the basal lobes. It will affect, guys. Okay, it will affect the basal lobes. It will affect. So it will affect these basal lobes. Okay, basal lobes. Okay, lower lobes it will affect. So what it can cause? It X-ray, if you take X-ray, it will show ground glass appearance. Okay, ground glass appearance. It shows ground glass appearance. And most common manifestation. What is the most common manifestation? That what we have seen. The most common manifestation is pleural plaques. That is the pleural plaques. That is the most common manifestation. This is asbestosis. The next one, what we have is byssinosis. Byssinosis. Okay, it's common on whom means common on people working textile industries. People working in textile industry exposed to cotton fibers. Okay, cotton fibers. This is byssinosis, guys. Okay, byssinosis. People working in textile industry and cotton fibers. Okay, cotton fibers. Okay, fine. Next is bagasosis. Okay, bagasosis. What is bagasosis? Okay, people exposed to sugarcane dust. Sugarcane dust. This is common in cardboard industry. Cardboard and paper industry. Okay, cardboard and paper industry. Okay, this is sugarcane dust. So this is sugarcane dust. Sugarcane dust. Okay, fine. So am I clear? Okay, so these are the points we should know regarding this. Regarding this occupational health, guys. Occupational health. Okay, fine. So am I clear? Yes, it's paper industry. Recently asked question is paper industry. Shall we take a break? 15 minutes. shall we take a break? 15 minutes. Okay. So we will start. Time is 8:03. We will start by 8:18, guys. Okay, 8:18. Is that fine? 8:18. Okay. Okay, fine. 8:18 we will start. 8:18 we will start. If there is any question is there, you put it there. Once we start, we can answer it. Okay, fine. 8:18. Okay. Just be back. Okay. So we'll try to finish by 10. We will try to finish it. Okay, fine. Yes. Okay, fine. Thank you. Hello students, am I audible? Is it coming or not coming? Okay, fine. Shall I start? Am I audible? Okay, fine. So okay, what is the answer for this question? What is the answer for this question? So this is we are topping a new topic called as screening. Okay, new topic called as screening. So so the answer for this question is, okay, they're asking positive predictive value. Okay, we'll see one by one. First is, what is sensitivity? Sensitivity means ability of the test to identify true positives. Sensitivity means ability of the test to identify true positives. Okay. So formula will be numerator true positives, denominator is diseased people. Denominator is diseased people. So diseased people means true positives plus false negatives. That is sensitivity. Sensitivity is ability of the test to identify true positives. Second, what is specificity? Specificity is ability of the test to identify true negatives. True negatives ability. So numerator is true negatives, denominator is non-diseased people. That is true negatives plus false positives multiplied by 100. That is specificity. The denominator is non-diseased people. Okay, fine. Third one is positive predictive value. PPV I will write. PPV is true positives. Denominator all are positives. True positives. Denominator is true positives plus false positives multiplied by 100. Okay, this is positive predictive value. Okay, fourth. Negative predictive value. True negatives. Denominator all are negatives. Okay, we will define each one. False negatives multiplied by 100. Okay, fine. All comes in percentage, guys. Everything comes in percentage. Okay, fine. Now, what is the question here is sensitivity is 90%. What do you mean by that? Sensitivity is 90%. What do you mean by that? That means out of 100 diseased people, the screening test can able to identify 90% of the people. 100 diseased people, you are doing the screening test. It can able to tell that out of 100, 90% has disease. Remaining 10%, even they are having disease also, it will show us negative. Okay, fine. Now, what is specificity? Specificity is 80%. What do you mean by that? So, what do you mean by that specificity 80%? In 100 normal people, if you do the test, it will show 80 people as non-disease. Remaining 20 people, even though they are not having the disease, it will show as positive. Okay, fine. So positive predictive value, the answer here is true positives plus false positives. Okay, true positives plus false positives. Okay, fine. Now we'll go to the next question. The diagnostic power of a test to correctly include the disease is reflected by. The diagnostic power is based on two parameters. One is positive predictive value. Second is negative predictive value. Negative predictive value. The question what they are asking is to include the disease. The answer here is positive predictive value. Okay, diagnostic power is based on two things. One is positive and negative predictive value. To include the disease. To include means it is positive predictive value. Exclude means it is negative predictive value. Okay, fine. So positive predictive value, what does it mean? What does it mean positive predictive value? That means Suppose in your ward you are sending people for some testing, you are doing it. Suppose fever case is there, you are testing for malaria. Okay, so all 10 results came as positive. Let us assume the positive predictive value is of peripheral smear. Let us assume 80% will keep. So that means out of 10 cases that we send for malaria, 8 are really positive. The remaining 2 are false positives. That is positive predictive value, which is more important where means it is more important in the hospital settings, in the wards. Okay, fine. So positive predictive value, PPV, yes, class is live, doctors. So positive predictive value is directly proportional to prevalence. Directly proportional to prevalence. More the prevalence, better the test. More the prevalence. So the prevalence, as the prevalence increases, the positive predictive value will increase. Okay, and negative predictive value is inversely proportional to prevalence. That also they won't ask. So prevalence, what they will ask is positive predictive value. This is a very common statement. Recently also they have asked. Okay, so positive predictive value, okay, is directly proportional to prevalence. Okay, fine. Next question, we will see the next one. Which of the following is an example for prospective screening? We have two types of screening. One is prescriptive screening. Okay, if you have any queries, put it on the chat box, guys. Okay, one is prescriptive screening. Okay, prescriptive screening means screening for their own benefit. For their own benefit. Okay, if you are doing screening for pap smear, whose benefit we are doing? We are doing for that person's benefit we are doing. So that is screening for their own benefit. Second, what is prospective screening? The question here is, what is prospective screening? Okay, so you are being screened for others' benefit. Screening for others' benefit. Okay, so you are being screened for others' benefit. That is prospective screening. This is a NEET question. I think last year, this is the NEET question. Okay, so you are being screened for others' benefit. Okay, fine. So what is the answer here? Answer. Okay, fine. So this is screening of immigrants. Immigrants is the answer. Okay, you are being screened for others' benefit. Okay, fine. So now also they screen. Okay, when you come in airport, they screen. Okay, during COVID times they were screening. Okay, so you are being screened for others' benefit. This is called as prospective screening. Okay, fine. Next, one more concept we will learn here. What is lead time? Okay, what is lead time? In the natural history of disease, understand disease onset will be there. First possible point of detection. First possible point of detection. Okay, usual time of diagnosis. Usual time of diagnosis. Okay, usual time of diagnosis. First possible point and usual time of diagnosis. This gap is called as lead time. This we call it as lead time. The time between the first possible point and usual time of diagnosis. Lead time. It's a common question. Okay, fine. Common question. Second, maybe a critical point will be there. Maybe a cancer is there. Okay, for the cancer, maybe a metastasis may be a critical point. So we have a final critical point may be there. Final critical point. For final critical point, this time is called as screening time. Screening time. Okay, the time between the first possible point and final critical point, we call this as a screening time. Screening time. Okay, fine. So am I clear? This is about lead time. Yes, lead time. Okay, fine. Okay. Next we will learn some other terminologies here. Okay, what is validity? What is reliability? Validity means accuracy, guys. How accurate is the screening test? Validity. And reliability means repeatability. Okay, reliability means repeatability. That means if you do it again and again, it should give the same result. That we call it as repeatability. If it is positive in one person, if you do it again and again, it should give the same results. Okay, this is validity, accuracy. Okay, whether it is measuring accurately or not. Reliability means repeatability. If you do it again and again, it should give the same results. Okay, so if you are remembering this much points for NEET exam, this is okay. NEET exam, this is okay. Sensitivity means ability of the test to identify true positives. Specificity means true negatives. Okay, fine. The statement of positive predictive value is multiple times asked. So what is positive predictive value? Is probability a person with the positive test result having the disease. That is positive predictive value. Positive predictive value means what is the chance, probability a person with a positive test having the disease. Multiple times it's been asked. Shall we go to the next topic? Yes or no? Next topic. Okay, fine. What about others? Fine. Under RCH program, intervention is done in selected districts. Look, we have, okay, RCH now converted into RCH 112 is converted into RMNCHA. This is RCH is converted into RMNCHA. Now, so under RC, since it has started, we should understand certain things. Under RCH program, it has 4 components. Okay, one is mother. Okay, second is child. Okay, third is family planning, and fourth is STDs. Okay, management of STDs. Out of this, which one is done in selected districts? Yes. That is treatment of STDs. Other components are done in all districts. This is done in selected districts. If you take mother component, they said we should be providing essential obstetric care. Okay, essential obstetric care. Okay, that means a normal delivery facility should be there. Antenatal care should be there. Normal delivery facility should be there. Okay, and postnatal care. This is essential obstetric care. This should be available at all levels, right from sub-center to medical college. It should be available. This is essential obstetric care. Second, they said that we should be providing emergency obstetric care. Okay, emergency obstetric care. Emergency obstetric care means what should come. Okay, so we are having 2 types of emergency obstetric care. Basic means we should be providing parenteral antibiotics, parenteral oxytocin, okay, parenteral anticonvulsant, so manual removal of placenta. Okay, these things we should do. That we call it as emergency obstetric, basic emergency obstetric. So manual removal of placenta, assisted vaginal delivery, so parenteral antibiotics. So these are called as basic emergency obstetric care. The second, is it come? Is it coming now? Yes or no? Okay. We'll finish it, guys. Okay, fine. So this is BMONG and CMONG facilities. Okay? This is BMONG and CMONG facilities. Okay, fine. Now, what is the answer for this question? What is the answer for this question? Okay, what is the answer? Okay, so this is IMNCA. What is the answer for this question? Okay, comprehensive you want. Comprehensive. Comprehensive means the facility should be providing, comprehensive means OT theater should be there. Then they should be having blood banks, they should be having, and they should be having anesthesia facilities. So that is comprehensive. To call it as a comprehensive, these are the facilities should be there, and it should be available at FRUs, first referral units, those place. And they said that they envision that it should be available at CHC level and sub-district level, it should be available. Sub-district level. Okay, fine. Fine. Now, what is the answer for this question? What is the answer for this question? Yes, this is IMNCA guidelines. IMNCA. Okay, IMNCA. So, what comes in IMNCA? In IMNCA, so for 0 to 5 years children, so we have certain conditions. So any child whenever they comes, so we are going to assess the child, classify the illness, identify the treatment. So we are going to divide them into 3 groups. Okay, okay, low risk. Okay, so low risk cases. And second one, we can manage at OPD level, we can manage. Low risk is home management. Home management. And the third one is pre-referral treatment, pre-referral treatment and referral, pre-referral treatment and referral. Okay, fine. So what is the color coding we are supposed to follow? For low risk it is green color, home management. For OPD it is yellow color, and pre-referral treatment and referral it is pink color, guys. It is the pink color we are supposed to follow. Okay, fine. This is IMNCA at the community level. So any child between 0 to 5 years, okay, so for diarrhea, for pneumonia, yesterday we saw pneumonia, okay, those management will happen here. Okay, fine. Now, so we also have one concept called as what is FIMNCA. Okay, FIMNCA, what is facility based FIMNCA? So according to FIMNCA, they said that we should have a newborn care corner. Okay, in all labor rooms it should be available. Okay, newborn care corner, it should be available at all labor rooms, guys, all labor rooms. Second, we should have a, this is newborn care corner. Second, they said that we should have a newborn stabilization unit. Newborn stabilization unit. Okay, this should be there at CHC level. Okay, we call it as NBSU, newborn stabilization unit. This should be available at CHC level. Next, we have special newborn care unit. Special newborn care unit. This should be available at where? District hospitals. This should be available at district hospitals. Special newborn care unit. So where it can able to take care of major things, it should take care, except ventilator and major surgery, and they can take care of all the remaining things they can take care. Special newborn care unit. Medical college, what we'll have is NICU. Okay, medical college, what we will have is NICU. Okay, medical college. Now, according to this FIMNCA, so we should be providing home-based newborn care. Who is going to provide home-based newborn care? Home-based newborn care. This can be provided by, who can provide this home-based newborn care? Home-based newborn care should be provided by ASHA. Okay, how many visits she has to make? If it is a hospital delivery, normal delivery, 6 visits. Home delivery means we don't endorse nowadays home deliveries. 7 visits. If it is LSES means 5 visits. If it's LSES, 5 visits. Okay, look here. So this, if they're asking only one, then it is 6 visits. Okay, she has to make 6 visits. This is home-based newborn care. This is ASHA. This is the responsibility of ASHA. Okay, fine. Next, we have some other programs related with child. One such program is JSSK. Okay, so what is available JSSK? Free OPD, free treatment, free blood, free transport. To whom? To whom it will be available? This is available for pregnant mothers and sick infants, guys. Sick infants. This is JSSK. Janani Sishu Suraksha Karyakram. This is JSSK. Next we have is called as NSSK. What is NSSK? Naujat Sishu Suraksha Karyakram. So what is available here? So they will be providing free, not free, training healthcare workers. Okay, so healthcare training workers on prevention of hypothermia. Okay, prevention of hypothermia and neonatal resuscitation. So they will be doing neonatal resuscitation. So rural areas we don't have doctors, and especially pediatricians are not available. Okay, so training workers, okay, on prevention of hypothermia, neonatal resuscitation, okay, at PHC level or that level, how to manage it. For that purpose they do. This is NSSK. We have one more program is there called as RBSK. RBSK means Rashtriya Bal Swasthya Karyakram. So what is being done in RBSK? So RBSK, okay, 0 to 18 years. Okay, we are going to screen the children. Okay, so child screening and early detection. Child screening and early detection. Okay, so we will be looking for diseases. We will see defects. 4Ds we will do: defects at birth, deficiency disorders, developmental delay, and diseases. So I am repeating again: defects at birth, diseases, developmental delay, and deficiency disorders. They will look for vitamin A and they look for anemia, goiter, all these things they can check. This is RBSK. Now the question recently asked is, whose responsibility to do this RBSK checkup? Yes, this is the responsibility of PHC's response, school health checkup. They will do the examination school. This is PHC, primary health center's responsibility. Okay, this is PHC's responsibilities. Okay, 4Ds. 4Ds fine. So it is primary health center's responsibility. So they have to check for all these things. Okay, fine. Next. We'll go to the next question, guys. We'll go to the next question. Okay. What is the answer? This is last year NEET question. What is the answer for this question? Yes. We will learn about ASHA. ASHA, she is part of this JSY, Janani Suraksha Yojana. JSY, Janani Suraksha Yojana. What is the purpose of this JSY? JSY is to promote institutional delivery by providing cash incentive to the mother. So you are going to provide money. So since 2005 it started. So you come and deliver in the hospital. Okay, fine. So ASHA, so what is the criteria for ASHA? Multiple times asked. So she should be between 25 to 45 years. Yes. And she should be for every 1,000 population. Okay. So 10 standard. Okay. So recent guidelines 10 standard for every 1,000 population. She should be widowed, married, or divorced. And she should be resident of the village. She should be resident of the village. Okay, fine. Resident of the village. So ASHA is a what type of worker? ASHA is a there is no fixed salary. What ASHA will get is performance based incentive. Based on the work she will get money, right? Now, so in India they divided India into low performing states and high performing states. Okay, low performing states in normal delivery, deliveries in institutional delivery, and high performing states. Okay, high performing states. So southern states will be coming in high performing states. Okay, Maharashtra, Karnataka, Andhra, Kerala. Okay, some northern states also will be there. So, but there are certain states. Okay, Rajasthan. Okay, at the time, Madhya Pradesh, Uttar Pradesh. Okay, so we have this Jharkhand. So those states. Okay, those states. So those states where it's where the institutional deliveries are low. So what they did is that, so these states are considered as low performing states. So they were providing incentive, how much money we were giving for low performing states and high performing states. It is in rural area and urban area. Okay, how much mother will get, how much Asha will get. Mother and Asha. So in a low performing states, mother will get 1400, Asha 600 rural area. Urban area, mother 1000, Asha will get 400. Right? So here in high performing states, 700 for mother, 600 for Asha, 600 for mother, 400 for Asha. Okay, fine. Now tell me Madhya Pradesh. Now see the question and answer. What is the question? The question is Madhya Pradesh, that too in urban area. The question is urban area. Madhya Pradesh comes in low performing states and urban area. So the answer will be this much. Okay, 1000 for the mother, 400 for Asha, guys. 1000 for the mother, 400 for Asha. Okay, fine. Last year NEET question, last NEET exam question. Fine. We'll go to the next question, guys. Okay, we'll go to the next question. All are true about National Urban Health Mission. So what is right? This is right, guys. Okay, so 2013 it started. Okay, and there will be 10,000 population. ANM will be there, and urban CHC there will be 50,000 population. What is wrong is this one. Okay, so urban health mission, they will be there for every 50,000 population. Any towns or cities, okay, so having 50,000 population, they will come under urban health mission. So what is the infrastructure they want to create here is urban health mission. Every 1000 to 2500 population, one Asha should be there. Okay, every 10,000 population, we have this ANM will be there. Every 50,000 to 60,000 population, we should have one urban PHC should be there. This is urban PHC. Urban PHC. Then every 2.5 lakh, 5 lakhs in metros. We should have one urban CHC should be the urban CHC. Okay, so usually CHC will have 30 to 50 beds will be there. Okay, not Asha only. Okay, and 30 to 50 beds will be there, and 5 lakhs metros, it should be 1000 beds should be there. 1000 beds. This was last year NEET question. This was last year NEET question. Okay, fine. 2022 NEET question. This concept was asked 2022 NEET question. Okay, fine. So 2 question came from this one and the previous one. Asha, how much remuneration is given for the mother and for Asha? Okay, fine. Okay, next question. In IDSP, which of the following diagnosis is done? So IDSP, what is the purpose of IDSP? Integrated Disease Surveillance Program. The purpose is to identify disease outbreaks. Okay, disease outbreaks. Okay, so they collect data from various sources. There is 3 forms are there. P form. P form means presumptive diagnosis. Okay, presumptive diagnosis. So who will fill this? Health workers, guys. Health workers. So we have to send data right from subcenter, PHC, Everywhere we have to send the data to this district surveillance unit. So sub-center people will send this P form. Sorry, P form is not health workers. P form is medical officers. Okay, P form is doctors. They will fill presumptive diagnosis. Okay, syndromic diagnosis. This is S form. S form is done by syndromic diagnosis. This is done by health workers, guys. This is done by health workers. Syndromic diagnosis is done by health workers. Okay, possible case of malaria, possible case of dengue. That is presumptive diagnosis. Fever with rash. L form. Confirmed diagnosis. This is given by lab, guys. Lab. Okay, lab. Confirmed diagnosis come from lab. Okay, so we will see certain terminologies. We will see programs. You tell me the name of the program associated with this name. Labor room quality initiative. Okay, labor room quality initiative. Okay, it comes what will be there? What is the name of the program? Yes, it is Lakshya. Okay, it is Lakshya. It is Lakshya. Labor room quality initiative. It is Lakshya. Okay, fine. Healthcare facility cleanliness award. Okay, what is this award called as? Best PHC, best CHC. What is this award called as? It is Kayakalp award. Okay, Kayakalp award. We are having an award called as Kayakalp award. That is healthcare facilities cleanliness award. Okay, so training health workers on newborn resuscitation. What is this? Training workers on newborn resuscitation. This is what? NSSK. Navjat Sishu Suraksha Karyakram. Okay. Child trafficking. What is this? Child trafficking. This is Ujawala scheme. Okay. Ujawala scheme. Ujawala scheme. Child trafficking is Ujawala scheme. Child screening and early intervention. RBSK. This is RBSK. Outbreak identification. It is IDSP. Okay, IDSP. Promote institutional delivery. Yes, it is JSY. Free transport for pregnant mothers. It is JSSK. Okay, it is JSSK. Leprosy. We have a campaign we do called as Sparsh campaign. Okay, Sparsh campaign we do. Okay, leprosy we have is Sparsh campaign. Provided assisted living devices. This is Rashtriya Vayostri Yojana. Rashtriya Vayostri Yojana. So prevention of STD, we have a clinic is there. What is the clinic? So the STD clinic is renamed as, yes, it is Suraksha Clinic, well-being Suraksha Clinic. Okay. Free antenatal services to identify high-risk mothers. Okay, yes, it is PMSMA. Okay, Pradhan Mantri Surakshit Matritav Abhiyan. For adolescent, what we have? Okay, so adolescent we have is RKSK, guys. Okay, for adolescent we have is RKSK. RKSK. Fine. So able to follow this? Yes or no? These are some of the programs. Okay. So no, don't worry about NEET exam. Very rarely they will ask updates. Okay, they don't ask updates. Okay, you stick on to basic concept. They are asking in a different way only. They are asking. Very rarely they will ask updates. Okay, very rarely. Okay, fine. RKSK. Fine. We'll go to the next question. Yes. Okay, fine. Monetary benefits is measured in which are the following analysis? Next question. Monetary benefits. Okay, fine. So this is cost benefit analysis. What is cost benefit analysis? Is cost is compared with the economic benefits. Okay, so I put this much money. So how much money I got? The answer is this one. Okay, this is cost is compared with the economic benefits. Cost effective analysis, but it is practically very difficult, not used in our field, because our benefit is more of number of disease prevented, death saved. So this is cost effective analysis is cost is compared with the effectiveness in terms of diseases and deaths prevented. Okay, diseases and deaths prevented. This is cost effective analysis. Cost effective analysis. Okay, input output analysis means, okay, so how much input? Okay, man, money, how much you put, how much output you got. Okay, that is input output analysis. Output may be disease prevented, okay, and deaths prevented. Okay, but not only cost we are not checking, we are also checking other things, other resources also. This is input and output analysis. How much money, manpower, other things what you put, what is the outcome you got. Okay, so what is network analysis? Okay, network analysis will show is a graphical plan of activities. Okay, so a graphical plan of activities to be completed, okay, to achieve end objective. Okay, so that is network analysis. You are trying to show graphically. Okay, suppose for example, okay, suppose I want to start one program, one activity I want to start. Suppose I want to start one new test. So USG I want to start. Okay, so first of all I have to order. Okay, order USG. Okay, order equipment I have to order. Okay, then I have to recruit staff. I have to recruit. Then train them. Then you install it. Then you start service. This along with the time, if you are explaining how much time it took. This is network analysis. Okay, so graphically you are trying to show, okay, for a activity. Okay, so how it will be achieved with the time. Okay, time. This is network analysis. Fine, we'll go to the next question, guys. We'll go to the next one. Answer this question. A man from Chhattisgarh presented with muscle weakness, leg spasms and pure motor weakness. Most appropriate history. Okay, most appropriate history. This is more like a what? The clue here is Chhattisgarh they have given, and it's more like a something related with the diet actually. So what condition they are talking? The condition they are talking is letharism, guys. The condition which they are talking is letharism. Okay, letharism. This happens because of consumption of BOA. Okay, what is BOA means? Beta oxalyl aminoalanine. Okay, so beta oxalyl aminoalanine. Okay, so if they eat over a period of time, okay, it will cause neuroletharism. It will affect the nerves, it will affect neuroletharism. So it will have 5 stages will be there. Latent stage, okay, no stick stage, you don't want stage, okay, no stick stage, 1 stick stage, 2 stick stage. Patient can go for crawling, okay, crawling, okay. So of diet, okay, the what is that called as? We call it as kesari dal, okay, kesari. This is mostly in central India, poor people will eat, okay, fine. Next, so we can learn some other terminologies here. One is, what is epidemic dropsy? Epidemic dropsy happens because of people consume mustard oil. This mustard oil is contaminated with, okay, mustard oil. This mustard oil is contaminated with arginamone oil. Okay, it is contaminated with arginamone oil. It is contaminated with arginamone oil. This arginamone oil contains a toxin called as sanguinarine. Okay, sanguinarine. Okay, so this causes epidemic dropsy, guys. This causes epidemic dropsy. So they will have, what are the features they can have? They can have glaucoma, cardiac failure, they can go. Okay, glaucoma and cardiac failure. This is epidemic dropsy. The second one is endemic ascites, guys. Endemic ascites. The second one is endemic ascites. In endemic ascites, okay, okay, there is one toxin called as pyrrolizidine alkaloids. Okay, so it is pyrrolizidine alkaloids. Okay, so this is endemic ascites. Okay, it causes ascites and jaundice, and case fatality rate is very high. Okay, so 30 to around 40% of deaths used to happen. Okay, so case fatality rate is very high. This is endemic ascites. Okay, endemic ascites. Okay, fine. Epidemic dropsy. So third one is aflatoxicosis. Aflatoxicosis. This happens because of aflatoxins affecting groundnuts. Okay, so Aspergillus flavus, some fungus are there. They will, when during the storage of groundnuts, and these fungus will go and affect the groundnuts, and if you consume them, you will develop aflatoxicosis. Okay, so what are the features they will have is hepatotoxicity will be there. So this is groundnuts, aflatoxicosis, Aspergillus flavus, Aspergillus parasiticus. Okay, fine. Next. So there should be a picture should be there. Next question. A 45-year-old man presents with skin changes. So I will tell what is the condition. This is Castle's necklace. Okay, so Castle's necklace, skin changes. Okay, so what is this condition? Okay, Castle's necklace. Yes, excellent. So this is what? So this is pellagra because of niacin deficiency. Okay, this is pellagra. This is because it leads to niacin deficiency. So what are the features it will have? Pellagra, what are the features? Okay, so diarrhea. So already is there, 3 Ds are there. So diarrhea, dementia, okay, dermatitis, and fourth one is death, guys. Okay, death. This is, okay, diarrhea, dementia, dermatitis, and death. Okay, fine. Sorry. Next is vitamin D. Some deficiencies we will see. What is the richest source of vitamin D? Vitamin D, the richest source is halibut liver oil. Okay, halibut liver oil. Okay, my voice is not good. Okay, so that's why I'm coughing. Okay, fine. So vitamin D, halibut liver oil. So in adults, okay, it causes osteomalacia, vitamin D deficiency. In children, it causes rickets. Okay, rickets. Okay, fine. Now, thiamine deficiency, what it causes? Thiamine, it causes beriberi, guys. Okay, beriberi it causes, and it can cause vernix encephalopathy. Alcoholics, it causes vernix encephalopathy. Okay, fine. Folic acid deficiency. Folic acid deficiency, it can cause megaloblastic anemia. Okay, megaloblastic anemia, folic acid deficiency. Vitamin B12, okay, so vitamin B12, where it is present? Okay, it's seen only in animal foods. Okay, animal foods. Okay, animal foods we have, and it causes pernicious anemia. Okay, pernicious anemia. Okay, vitamin B12. Next we have is scurvy. So that is vitamin C. It causes deficiency, causes scurvy. Richest source is gooseberry. It causes scurvy. Bleeding gums will be there. You will have bleeding gums, and delayed wound healing will be there. Okay, the questions are more application oriented on disease, public health disease only they are asking. So you can answer it. Okay, you can answer it. Fine. Next question. We'll go to the next question. What is the dosage of vitamin A for a 2-year-old boy with keratomalacia? So vitamin A, the richest source is what? Richest source is halibut liver oil. Halibut liver oil. And first it starts as night blindness. Okay, first it starts as night blindness. Okay, fine. Next it goes to conjunctival xerosis. Okay, xerosis. Okay, then Bitot spots. Then you have this corneal xerosis. Then it goes for keratomalacia. Corneal xerosis. Okay, this is how it goes. Night blindness, conjunctival xerosis, Bitot spots, and corneal xerosis. The treatment is what? Yes, the treatment is, so any child, it is 0, 1 and 14 days. What is the child? 2 year. Okay, more than 1 year means it is 2 lakh international units per dose. Okay, more than 1 year means 2 lakh international units. Okay, fine. Okay, more than 1 year, it's 2 lakh international units per dose. Okay, fine. Now, so am I clear? So this is about vitamin A, guys. This is about vitamin A. Fine, next. Answer this question, guys. Project Monica is related to. It is not who's Monica. The question is Project Monica is related to what? It's a NEET question. Okay. It is related with cardiovascular disease. Okay, cardiovascular disease. Project Monica. It's an old study, guys. It's an old study. It's related with cardiovascular disease. Last year we had a question is steps assessment is done for. Steps assessment. Okay, steps assessment is done for. Last year this was the question. Steps assessment, it has 3 steps. This is done for NCD risk factors. Okay, this is being done for NCD risk factors. Step 1. Okay, suppose I want to do a study in the community, okay, regarding NCD risk factors, I can follow this. Step 1 is for, what is the purpose? Is we will take questionnaire. In questionnaire we will ask for risk factors. Questionnaire for risk factor. Are you a smoker? Are you an alcoholic? Okay, those things we will do. That is step 1. Step 2. Step 2, you will do physical measurements. Okay, like height, weight. Okay, you can take this. This is step 2. Physical measurements. Example, height. You can measure. Weight, you can measure. This is step 2. Step 2. Third, Third, what you can do is biochemical measurements. Okay, biochemical measurements. Okay, biochemical measurements. Okay, so you will do fasting blood sugar. Okay, those things you will measure. FBS, PPBS, those things you will measure. This is step 1, 2 and 3. So am I clear? This is step 1. This was last year NEET question. So what will you do? Okay, so you will measure, okay, for their what are their risk factors, behavioral things you will measure, okay, and physical you will do this, and fasting, postprandial, cholesterol, all these things you will measure. Okay, this is steps assessment. Fine. NCD, what is the most common cancer among males in India? In India, most common cancer is oral followed by lung. For females, it is breast cancer. Okay, females it is breast cancer. Overall, if you take overall, it is breast cancer. First is breast cancer. Overall it is breast cancer. Guys, overall. Fine. Not lungs, man. It's oral. First is oral, followed by lungs. We are talking about India. What does this vector transmits? Okay, so this is, I think yesterday we saw this picture. This is what? This is sandfly. Okay, what is the answer? Sandfly. Sandfly transmits oriental sore, but we are not worried about oriental sore. We are more worried about Kala Azar. Kala Azar is endemic in few states in India. Okay, so Kala Azar is more common endemic in UP, Bihar, okay, West Bengal and Jharkhand. This was asked once. Okay, this was asked once. This is sandfly. Patient will have fever more than 2 weeks with hepatosplenomegaly is there, means from these states we have to rule out Kala Azar. So anybody is having fever, hepatosplenomegaly, from these states we have to rule out Kala Azar. So what is the test we will do? So splenomegaly, you write splenomegaly. So what is the test you will do? Okay, what is the test we will do? So we will do, government is providing a kit called as RK39 kit. Government is providing this kit RK39. If anybody is found to be positive, they should be provided, what is the treatment? They should be provided liposomal amphotericin B. Okay, liposomal amphotericin B. Okay, so RK39 kit. So the main drug what we have, recently also we had question. Government is providing this kit for these states, and liposomal amphotericin B. We have one more drug is there called as miltefosine, also we can use. Miltefosine. Okay, we can use miltefosine also. But the drug of choice, if they say, it is liposomal amphotericin B, guys. Liposomal amphotericin B. Fine. Next. False about arboviral infection. Yes. The next question, false about arboviral infection. False. Okay, we'll go statement wise. Yellow fever is not present in India. True. Yellow fever is not present in India because we are following certain measures. Dengue has only 4 serotypes. That is also true. Okay. Chikungunya is transmitted by Aedes. Yesterday we saw. Dry chicken Zika we saw. Dry chicken is there, na? So that is also right. KFD was first identified from Karnataka, not in West Bengal, guys. Okay, Karnataka. Fine. Regarding yellow fever, first thing you already seen, it's not present in India. Okay, so to prevent entry into India, we are having a program. So we are having a vaccine, 17D vaccine strain. If you are taking this vaccine, they will be providing a certificate. So international yellow fever certificate we will be providing. International yellow fever certificate. So we will be providing international yellow fever certificate we can provide. So in this certificate, yellow fever certificate we will provide. The validity starts from 10 days to lifelong, guys. Okay, the validity starts from 10 days to lifelong. This was asked last year. Last year NEET question. Last NEET exam question 2022. This was a question. 17D, this is one activity. And seaports and airports, no breeding. Seaports and airports. Okay, no breeding place for 400 meters. Okay, there should not be any breeding place for 400 meters with seaports and airports. Guys. Seaports and airport, there should not be any breeding places. And they started IE strategy also. What is IE strategy? IE strategy is elimination of yellow fever epidemic strategy. Okay, elimination of yellow fever epidemic. WHO started this strategy. Elimination of yellow fever epidemic strategy. Okay, yellow fever epidemic strategy. Okay, fine. So this is about yellow fever, guys. These are the points we should know regarding yellow fever. Okay, fine. Last year we had a question 17D. Okay, so if you're not answering, you won't get the rank. Okay, such type of questions. Okay. So what is this criteria? To achieve neonatal tetanus elimination, every district, the incidence of neonatal tetanus is, okay, it should be less than 1, guys, less than 1. Okay, so we achieved this neonatal tetanus elimination we have done actually. So what is the criteria we have is less than 1 case, okay, per 1,000 live births. Okay, in all districts. The question is that all districts. Okay, it should be there at every district. It should be there at every district. Okay, fine. Usually the question that will come is injury that will come. Okay, in tetanus, usually we will have some form of injury. So if any injury is there, less than 6 hours, clean wounds, any wounds, more than 6 hours, unclean wounds. Okay, we have 2 types of injuries are there. So you have to ask immunization status. When was the vaccine taken? Okay, you have to ask. Less than 5 years means nothing is required. Here also you need not to provide anything, nothing. 5 to 10 years, 1 dose you have to provide. Here also 1 dose. You have to ask when was the vaccine taken, and any wound you have to classify it. Okay, less than 6 hours. Okay, so 5 to 10 years means 1 dose. Okay, here also it's 1 dose, more than 6 hours. So more than 10 years means 1 dose. Here also 1 dose, plus you have to add immunoglobulins. You have to add immunoglobulins. Okay, unimmunized means you have to provide 2 doses. So here also you have to provide 2 doses plus immunoglobulins you have to provide. Immunoglobulins, this you have to provide, immunoglobulins. Okay, so unimmunized means this you have to provide. So these are usually the 2 questions that will come from tetanus, guys, usually. So you have to ask the immunization status, you have to ask. Fine. Now, true about epidemiology of malaria. So what is true about epidemiology of malaria, we will see. Fine. First is, in India, the transmission season of malaria is July to November. This is the transmission season. So June is considered as anti-malaria month. Anti-malaria month. Okay, fine. Now, so already told you who is the definitive host. Okay, fine. So mosquito is the definitive host. That is true. Rare in urban areas. That is wrong. Man is the definitive host. That is wrong. Definitive host means where sexual cycle has to take place. Where sexual cycle happens. Okay, in common, this is also wrong. And this is also wrong. What is this extrinsic incubation period? Extrinsic incubation period is time for mosquito to become infective. Okay, time for mosquito to become infective. That means today it's taking a blood meal with gametocytes. After how many days it will be infective to others? So that is extrinsic incubation period is 10 to 20 days, guys. It is 10 to 20 days. Okay, 10 to 20 days. Okay, fine. Now, suppose a case of malaria is positive. So what is the treatment available? So we have Vivax. Okay, Vivax means we give chloroquine for 3 days, Primaquine for 14 days to prevent relapse. So chloroquine you are going to provide for 3 days and Primaquine for 14 days. If it's a case of falciparum, what is the treatment? If it's a case of falciparum will not work. Okay, sorry. Chloroquine will not work with falciparum. So falciparum has become resistant. So you have to provide ACT therapy for 3 days. Artesunate, sulfadoxine and pyrimethamine combination. And Primaquine you have to give for 1 day. This is falciparum. Suppose the question very specifically, few years back we had a question, very specifically they said that falciparum in northeastern states, okay, where what happens is even this ACT also it becomes resistant, so you have to give in such circumstances artemether, okay, plus lumefantrine. Okay, artemether plus lumefantrine, guys. Okay, this is artemether plus lumefantrine. Okay, fine. So am I clear? Yes. We'll go to the next question. Yes, we'll go to the next question. Okay, so all of the following are true regarding leprosy except regarding leprosy. Okay, so all are right. This one is wrong, guys. Okay, one of the diseases I already said that has been eliminated is leprosy. What is the elimination criteria? The elimination criteria is less than 1 case per 10,000 population. Less than 1 case. Okay, to call it as, this is what this option. To call it as defaulter means that has to be 12 months, guys. Defaulter means 12 months. What is the malaria treatment in pregnancy? Look here. For Vivax, you have to give chloroquine, guys. For Vivax, you have to give chloroquine. Primaquine is contraindicated. For falciparum, in first trimester, ACT is contraindicated. You have to give quinine. Second and third trimester, you can give ACT. But here also, Primaquine contraindicated. Falciparum, first trimester give quinine. Second and third trimester, you can give ACT. Okay, so we have this 5 lesions. Okay, more than 5 lesions. We have multibacillary and paucibacillary. And paucibacillary, what is the treatment? So PB, paucibacillary, we are providing dapsone monthly. Dapsone, I am talking dapsone. And what is the dapsone? Dapsone will provide daily. And rifampicin monthly, guys. Rifampicin monthly. Okay, rifampicin monthly. This you have to provide for 6 months. This you have to provide for 6 months. Paucibacillary. Multibacillary. Okay, multibacillary you have to provide dapsone daily. Clofazimine. Okay, so dapsone daily. Clofazimine daily. And this is Indian treatment. WHO means all 3 drugs will come. So this is what our government does. And third one is rifampicin monthly. This you have to provide it for how long? For 12 months, guys. 12 months. Okay, so this is the treatment available for leprosy, guys. This is the treatment that is available for leprosy. And we have a test available, lepromin test. So what is the use of lepromin test? Lepromin test is not a diagnostic test. It is used to estimate prognosis. Okay, so mostly leprosy we diagnose clinically. Clinically we diagnose. So lepromin test is not a diagnostic test. Okay, it estimates prognosis. I am repeating, prognosis. Question 39. 3 more question, guys. 3 more question. Answer this question. What is the answer for this question? Yes. Yes. Okay, so we can give this lamivudine, tenofovir and dolutegravir. Okay, fine, this we can give. So in India, so we have this NACP is the National AIDS Control Program. 1, 2, 3, 4 and currently we have 5. So this program right now, okay, so for diagnosis of HIV, okay, so we send them to ICTC. If anybody is positive, what is the current treatment? The current treatment will give TLD part, tenofovir plus lamivudine plus dolutegravir. Okay, so lifelong ART. Immediately you have to provide. Immediately, the question is immediately you provide lifelong ART. This is the treatment, tenofovir, lamivudine and dolutegravir. Okay, fine. So what about PPTCT? Prevention of parent to child transmission. Okay, parent to child transmission. If mother is HIV positive also, you are going to provide the same treatment, lifelong ART. Lifelong ART you can provide immediately, lifelong ART. So tenofovir, lamivudine and dolutegravir. Okay, and for baby you can give nevirapine syrup. You can give for baby, you can give nevirapine syrup. Okay, for 6 weeks you can give. This is the treatment in HIV, for HIV. Immediately lifelong ART as early as possible. On the same day also they can start the treatment. Okay, fine. This is for prophylaxis. This is one combination available, post exposure prophylaxis. Okay, or we can also give raltegravir, tenofovir and emtricitabine. This combination also we can give. Okay, we can provide raltegravir, tenofovir plus emtricitabine. This combination we can give it for 4 weeks. 4 weeks you can give. Okay, yes. Which are the following RTA or STA codes kids wrongly matched here? What is wrongly matched here? Wrongly matched. Okay, fine. Yes. So this is Suraksha Clinic. I already told you Suraksha Clinic. Okay, Suraksha Clinic is fine. So what we do here in Suraksha Clinic, so we use an approach called as syndromic approach. Okay, we use an approach called as syndromic approach. That means a patient comes with a particular syndrome. Don't waste time there. You just provide it. Okay. Now, drugs, we don't have facilities. So what are the various syndromes we have this? So we have this urethral discharge is there. That is syndrome 1. Okay, comes cervicitis will come. Second, we have vaginitis. Third, we have GUD, genital ulcer disease they will have. Fourth is GUD, patient is penicillin allergic. Okay, fifth is GUD, painful, it is there. GUD means genital ulcer disease. Sixth is lower abdominal pain. And seventh is buboes, inguinal areas. Some buboes are there, inguinal buboes. So these are the various syndromes available, guys. These are the various syndromes, and we have a colored kit is available. So first is gray color kit, second is green, okay, white, blue, red, okay, lower abdominal pain, yellow, and this is black. These are the various colored kits available. So if anybody comes with a particular syndrome, you can give the kits to them. Okay, this is urethral discharge, cervicitis, vaginitis. Okay, so this is what you have to do. Now tell me what is the answer here. What is the answer? First is not black, that is wrong. Two options are wrong. Kit 4 is also wrong. Kit 4 is actually, it is blue. Penicillin allergic. Okay, penicillin allergic, it is blue, guys. It is blue. Okay, fine. So am I clear? Shall we go to the last question, guys? Shall we go to the last question? This is the last question. Yes or no? Answer this question. Answer this question. Okay. Answer this. What is the answer? Sharp waste is disposed in. Yes. Sharp waste we dispose in what? Is it blue or white? Yes, it is white container. Okay, white container. So yellow usually commonly asked question. Yellow is, okay, you can put anatomical waste, guys. Okay, anatomical waste. Okay, chemical waste. Okay, blood bags. Okay, some culture media. Okay, culture media. All will go to yellow color. Red color, you will have these the rubbers. Catheter will be there. Okay, tubes, plastics will be there. So syringe. Okay, catheter will be there. So all these will go to gloves. Commonly asked question is gloves. Commonly asked question is gloves. Okay. White is sharps. And blue is vials, ampules. So all these things will come, and you have this metallic implants will come. Metallic implants. Okay, metallic implants will come. Okay, metallic implants. Okay, so sharps, metallic implants. So recently asked question is pacemaker. Where will you dispose pacemaker? Pacemaker, where will you dispose? Yes. Pacemaker, where will you dispose? Okay, blood bags, yellow. Pacemaker is metallic body implants. Metallic body implants will go to blue color. Blue color, K wire. Okay, metallic body implants, it will go to blue color. Okay, fine. Okay, fine. So, okay, guys, we'll stop with this. So, we can stop with this. And your time is very precious. Hopefully, we covered something. Okay, it should be useful to you. Okay, and so any comments, you post it in the comment section. So, broken vial goes into any vial, guys. Any vial, it goes into blue. Okay. Urine bag, red, fine. Urine bag is red, fine. Okay. So my voice is not clear, so that's why I had some difficulties. Okay. So we try to cover as much as possible. Okay. So all the best, guys. Okay, just study well. Okay, if you have any comments, you put it in the comment section. Okay, we'll try to see that or try to answer it. Okay, fine. Okay, so listen, you keep it simple. Your exam is usually in our subject, they won't complicate much. They will keep it simple. Whatever notes you have, read it and revise it. Exam is all about remembering. Understand? It's all about remembering. Don't search for new things. Okay, focus on what you are having. Revise new. Don't go for new things. Revise what you are having. Okay, most of the questions will come from there. So don't worry about the 5 to 10% of questions. You focus on the 90% of questions. Even if you are remembering 70 to 80%, so you will get a very good rank. Okay, so am I clear? Okay, so thank you guys, okay, for being with me. Okay, so tomorrow we will continue the session. Okay, PW will continue the session. Okay, just be part of it. Thank you guys.